Welcome to the first AANEM Virtual Neuromuscular Fair. We are excited that we had the opportunity to do this. Something that's not been out there before. Super wonderful to be able to do it. Thank you, program directors, coordinators, everybody for putting the materials together and joining us. That is very much appreciated because I know how busy all of your schedules are. Residents, this event was created for you so that you will have a chance to hear firsthand from each of the programs a little bit about their program and their fellowships, so you can make a well-informed decision when you start applying for fellowships. So without further ado, I think we'll go ahead and get started. So sit back, relax, and let's just get started. So you are ready to take it.
Okay, very good. Thank you. My name is Dr. Ajrud Driss, Sanda Ajrud Driss. I'm the Neuromuscular Medicine Fellowship Program Director at the McGaw Medical Center at Northwestern University. We are situated in the center of Chicago. I'm sure you all know Chicago is the third biggest city in the US. It has the large city feel, but also the small town feeling with all the neighborhoods. So it's not intimidating big city. It can be very cozy sometimes. Let me introduce our faculty. So of course, myself, the program director, our division chief is Dr. Robert Cobb. Dr. Sadiq actually started this program. He started the neuromuscular medicine at Northwestern in the early 90s, quickly followed by Dr. Safet. And I joined after as the third faculty. And I am a graduate of this program, so I can tell you firsthand about my experience. As you can see, a few of our graduates joined the rank of faculty. Dr. Jonathan Brandt, Dr. Colin Friends, which is actually a trained physiatrist with neuromuscular expertise now. And we have, in addition to our faculty, Dr. Sun, who joined us this year. I think we are probably the only program in the country that have two full-time pulmonologists, we call them. They're pulmonologists. They staff our MDA and ALS clinic, and they work closely with our fellows as well. Of course, we work very closely with our pediatric colleagues. Dr. Nancy Coons directs the pediatric neuromuscular division, and Dr. Rao and Shweed are actually both graduate of our program. Our program does train pediatric neuromuscular fellow as well as adult. And every year we have the capacity to train 4 fellows, 2 pediatric and 2 adults. This is where the magic happens at Northwestern Memorial Hospital. We have multiple towers. The campus stretch over the downtown area. It's the biggest hospital in Chicago. We see our patient in the neurology clinic that just moved a couple of years ago to this new lab and family pavilion. The children, the Lurie children is across the street, and the Rehabilitation Institute of Chicago, which is the #1 rehabilitation institute in the country that is now named Shirley Ryan Ability Lab, is not far away. And our really, I mean, few blocks from the main hospital. And our fellow do train there for their rehab experience. So this is the footprint. We're really at the border, at the shores of Lake Michigan. We're between Lake Michigan and Michigan Avenue, or the Magnificent Mile. We're straight downtown. All the buildings, of course, are connected. You don't need to go outside. There's tunnels and bridges. But this is the footprint of the campus. We are housed in the Department of Neurology that is growing. We have 140 clinical and research faculty. We're ranked top 10 in NIH funding, and we're top 5 in US News and World and US News. We are, of course, #1 in Illinois. So what do we offer? We have state-of-the-art EMG laboratory that works the whole week, sees about 8 to 10 patients a day. We do have an autonomic laboratory as well. We see our patient in our multidisciplinary ALS clinic, which actually is the oldest ALS clinic in the country. We see about 80% of ALS patients in the greater Chicago area. Our ALS clinic meets twice a week. We have a Muscular Dystrophy Association clinic that meets once a week. And of course, a general neuromuscular clinic, or we call it also a fellow clinic, that meets once a week. We have opportunity for nerve and muscle pathology as well. This is the prototype of a fellow schedule. As you can see, I don't want to go into the details, but the Monday and Tuesday are usually more EMG focused, and then the rest of the week is more clinic focused. The fellow does go throughout the week to the pediatric Lurie children for the pediatric neuromuscular exposure, and they also go to the Rehab Institute for their rehab exposure. They do have a half a day of research weekly. Scholarly activity is very important, and actually many of our fellow do publish during their first year of fellowship. So these are the publication of the past and current fellow also. I think that's about it, and I'll be happy to answer any question that you guys may have.
Nice to see you all, and thanks for being here at this late time. I am Kurosh Rezania. I am the director of the Neuromuscular Fellowship Program in the University of Chicago. University of Chicago, you see downtown Chicago up here, and we are here in the Hyde Park area, the historical area, Hyde Park, Kenwood. This is, it's about 20 minutes ride to the down 10 to 20 minutes, depending on the traffic. Here is the map, and here is we are close to the Lake Michigan. We are in sort of the south side. It's a very old university. We have the highest number of the Nobel Prize winners in the world. I think we have 78 in this university. Here is our Department of Neurology, taken 2019, before the pandemic, and this is our new fellow, actually our current fellow, who is in the audience, Dr. Radarski. At that time was a chief resident. So Neuromuscular Fellowship Program is a new one. We were ACGME approved starting April of 2019. Our first fellow is going to graduate in 2021. It's a one-year program. It's a multidisciplinary fellowship. We train for the adult and pediatric neurology. Our adult and pediatric neuromuscular, I mean. The adult clinic, we are having ALS multidisciplinary clinic, and we are in the process of establishing myositis clinic, in addition, in collaboration with our rheumatology colleagues. For the pediatric part, we send the patients to a colleague who was one of our faculty and moved to the Shriners Children's Hospital. We do, our fellows do advanced autonomic testing in Glenbrook Hospital, which does the most advanced autonomic testing in the Chicagoland. We also train fellows for the nerve and muscle biopsy interpretation and observation of the nerve and muscle biopsies. So these are the two hospitals. So we have satellite hospitals. The main part of the fellow time will be spent on the campus, in the Hyde Park campus in the University of Chicago, but they, in about 1 day a week for 4 months, they go to the Shriner Hospital for the MDA clinic, and 2 days a week for 4 months they go to the Glenbrook Hospital in the north side of the Chicago. So these are the goals of the program are again the diagnosis and treatment of the adult and pediatric neuromuscular diseases in an advanced level. Advanced EMG, including we try to train our fellows in the single fiber EMGs again, although this test is done less and less, and is a challenge to do that volume wise. Again, autonomic testing, I think, is one of our strengths in this program. We have one of the better interpretation of the nerve and muscle biopsies. We get a lot of referrals from multiple other hospitals in the Chicago and the neighboring states. We do a limited number ourselves. We want our fellows to be board certified in the neuromuscular medicine, and if they are interested, depending on their interest, they will have exposure to the clinical research. We have a good track records of the previous residents and the fellows for the publications. These are our number of the faculties. Dr. Raymond Roos, one of the top-notch ALS specialists in the world, is our ALS clinic director. We have Dr. Sullivan and Rubez in the EMG lab. I didn't include my own because you're seeing me. Dr. Peter Pytel is our neuropathologist. We send our fellow half a day per week to read nerve and muscle pathologies. Dr. Silver is a neuromuscular pediatric specialist that we have the fellow rotate with him. And Dr. Horowitz is our neurosurgeon who does our nerve and muscle biopsies. Again, we have this is not expected for the fellows to learn how to do nerve and muscle biopsy, but we are open to investigate that if somebody is interested in it. Again, we don't know about the volume, whether we have enough volume to do that, to train, but they will certainly observe it. Dr. Barboy is the director of autonomic and neuromuscular clinics in the North Shore University. And again, we are collaborating with our rheumatology fellow department to open a myositis clinic. Again, this is our strength, is we want to train our fellows for the advanced treatments that are coming for in the treatment of the myositis and rheumatological inflammatory neuromuscular diseases, all these monoclonal antibodies. That is a very dynamic field, as well as those genetic treatments, muscular dystrophies or congenital myopathies. I think we have, we will be strong in that field as well. And that is my talk. I think it took way less than 10 minutes.
My name is Diana Zakhanova. I'm one of the neuromuscular attendings at University of Illinois at Chicago. So I just wanted to tell you a little bit about our program. I'm one of the neuromuscular physicians. Dr. Charles Abrams is the fellowship director, who's also here on the fair. So I just wanted to tell you where we're located. We're located a little bit west of downtown, about a 10-minute ride on the car, so not too far away. Pretty quickly, right next to West Loop neighborhood, which is up and coming neighborhood, right next to Italian Village. So lots of good neighborhoods around us. So this is our faculty. Dr. Charles Abrams is our fellowship director. He's also division chief of neuromuscular division. You see me here next to Dr. Abrams. We have two new faculty who joined us recently, Dr. Pratikanta Paul and Dr. Akash Patel. Dr. Pratikanta Paul has just finished fellowship at Mayo, Rochester, just started recently this summer. Dr. Patel just finished fellowship a year ago here at UIC, so he came back and joined our faculty not too long ago. Our fellows also rotated at the Jesse Brown VA Medical Center. So below you see Dr. Chin Lee, who is also neuromuscular trained at UIC. And then we also have Dr. Kenneth Silver, who is a pediatric neuromuscular specialist at Shriners Hospital for Children, where our neuromuscular fellows rotate twice a month. So just quick details about our fellowship. It's a one-year ACGME accredited fellowship. We usually have one fellow per year. And our fellows rotate at the main hospital, University of Illinois, clinics, Jesse Brown VA, and also Shriners Hospital. So basically the majority of time is spent at University of Illinois, Chicago. There are a day and a half that a fellow spends at the Jesse Brown VA. And then our fellow also spends two days out of the month at Shriners Hospital for Children's for the pediatric MDA clinic. Our subspecialty clinics include MDA-sponsored neuromuscular clinics. This is our multidisciplinary MDA clinic where we see all the multidisciplinary disciplines. And these clinics, we have two half days per month. We also have the MDA-sponsored pediatric neuromuscular disorders clinic, which is at the Shriners Hospital. We also have ALS Association Center of Excellence clinics at UIC, which are also 2 half days per month. CMT Association Center of Excellence as well. Dr. Abrams subspecializes in CMT patients, and that's what his main research is in. And we also have general neuromuscular clinics at the Jesse Brown VA. Our EMG lab is mainly at UIC, but our fellows also rotate at the VA EMG lab. And also we have opportunity for neuromuscular inpatient consults and also inpatient EMG consultations as well. In our EMG lab, we have routine studies as obviously neuropathy, radiculopathy, flexopathy evaluation, but also myopathy evaluations as well. We also perform repetitive nerve stimulations, facial nose oblique reflexes, as well as single fiber EMG and skin patch biopsy. So our fellows have opportunity to perform all of the above. Didactics include monthly lectures on main neuromuscular lectures. We also have weekly EMG nerve conduction study lectures led by the Jesse Brown VA faculty. And our lectures include rotating lectures about journal club, main topics of electrodiagnostic topics, challenging EMG cases, and board review questions. And we also have weekly nerve and muscle pathology lectures, and these are actually done with the help of our colleagues at University of Chicago with Peter Pytel. Research is expected, and our fellows typically concentrate on clinical projects typically and are required to publish either at the end of the fellowship or later on. And this is a photo of some of our multidisciplinary group, our former fellow, our nurse, physical therapist, and clinical neurofits fellows. This is our contact information, Dr. Charles Abrams, our fellowship coordinator, and myself. Please feel free to contact us. We're happy to answer any questions. And that would be it for me.
We're going to move into the question and answer period. So for those of you wanting to ask questions, please utilize the chat, and we will kind of look at those chat questions as we go along and answer those questions. While we're waiting for some questions to come through, one of the questions that Shalyn Atkins, the executive director, has been asking to kind of help is, can you share with us what drew you to neuromuscular medicine? I mean, why did you choose neuromuscular medicine over some other specialty?
That's a very good question. I personally was attracted to neuromuscular medicine because I thought it's one of the only subspecialty in neurology where your exam is still very important, where you get to use your reflex hammer. It doesn't matter what the imaging will show. You have to be a good clinician. You have to take a good history and do a good exam. And really, it personifies the importance of what we do in neurology when we try to localize. So when you're a neuromuscular physician, you're trying always to localize, and that exercise is actually very important. And that's what drew me to neurology to begin with. The other thing is neuromuscular medicine is very rich in genetic diseases, and figuring out when I started my journey, it was very early on when we didn't know what the genes were, and we were kind of discovering the difference between the CMTs, the limb-girdle muscular dystrophy, the ALSs. So that was very, very exciting time to kind of figure out the pathophysiology of these diseases.
Yeah, I think also I agree with Sandra, and I was also I was interested in the EMG because of the very, very objective and very reproducible way of assessing the problem. Whereas when I was exposed to the EEG, there was a lot of inter-rater variability. Different people read things, differently. I was impressed at how objective EMG is. And neuromuscular, I found it to be very challenging. There are only a few specialists, and muscle disease especially is very, very challenging. It's very hard to master it. That's why I was challenged by it and was interested in it. I'm interested in the entire field of neurology, but this one was more of a challenge for me.
Yeah, I think I agree with both Dr. Driss and Dr. Rosania. I think it's very diverse between muscle, neuromuscular junction, and nerve. So it keeps my interest. There's so much to learn and continue to learn. There's so much new research that comes out, and just the fact that we can localize, and I think we're one of the best clinicians among other neurological subspecialists, is because we base our diagnosis based on history and exam, which I think is very fun to perform. So it's a very fun subspecialty. I really, really love it.
Dr. Abrams, do you want to speak?
Yeah, so I chose neuromuscular primarily because I was interested. My background, my research background is actually in ion channels and electrophysiologic evaluation of ion channels and ion channel diseases. And I actually work on gap junction proteins now, which are channels connecting different cells. In fact, I work on the one that connects 32, which is a gap junction protein that causes CMT1X. But anyway, so I actually was drawn to the electrophysiology, both at the cellular level in terms of understanding channelopathies and the role of calcium influx in at the time, we didn't know too much about genetic muscle disease, but we were starting to understand Duchenne. And myotonic dystrophy the gene had just been cloned when I was making my decision about what to do. And so that was really, I think myotonic dystrophy was the disease that really caught my eye in terms of what the origin of myotonia was, and that sort of connected with my interest in electrophysiology in general. And the truth is now, in this day and age, I probably would have been even more drawn to the genetics, but there was very little genetics at the time. So that's not what drew me then. But that is the thing that I think I like the most about it now, is the very strong emphasis on genetics and genetic disease and mechanisms, that link back to a single gene defect where we really can start to understand what causes human disease.
Thank you. Okay, we have one question out there right now that says, what is one aspect of your program that you would say is your strongest asset or is unique to your program?
I think our program, we expose the fellows to a very good level of the autonomic testing, which is not a requirement of the neuromuscular fellowship, but they will get a very good exposure to that in a very high level. I think neuromuscular pathology is a plus in our program.
Coming from the fellows program, sorry, that's my 11-month-old.
Actually, this one is our fellow.
Yes,
so
I am the current fellow at U of C. At least from my perspective, we're exposed to a lot of extremely complicated cases. I mean, we almost routinely or regularly see very refractory cases, for example, refractory myasthenias and inflammatory polyneuropathies, for example. But I like the fact that we can carry these patients through the entire process. So they, for example, they can come into the emergency room. We can do an EMG inpatient right away. And then if a biopsy is required, I can actually go with the neurosurgeons to get the biopsy sample and then literally walk it down to Dr. Paitel's lab and take a look at it and start the proper treatment. So we have exposure to every step along that way, along that process. And again, the cases are very challenging.
Yes, that's all good. But you know what they say, location, location, location. You really cannot be downtown location. We are right downtown. The whole campus is there. You don't need to go anywhere. Children is a block away. Rehabilitation Institute is next door. I personally do autonomic testing. You do not need to travel. You don't need to go anywhere. We're the first neuromuscular program in the city, actually, where the program director is a graduate of the program. So I know the ins and outs of it. I think, but what differentiates our program is really our faculty are very interested in teaching. We do get the same complicated, I think we're all tertiary center, we do get complicated cases. The breadth of our clinic meets often. I mean, we have 2 afternoon ALS clinic. We have 1 weekly MDA clinic, and then the children MDA clinic also meets every week, and the exposure to rehab that is important for the fellowship and the exposure to pediatric diseases is done throughout the week. So you don't cut, you don't change your schedule. The schedule is almost the same throughout. And that, I think, allows for a great training experience. We have a track record. We probably have already graduated at least 10 or 12 neuromuscular fellow. There is a lot of people that you can go back to and ask about our fellowship.
I don't know if Dr. Adams wants to add to my answer, but I think as a state institution, we see such a wide variety of patient presentation and a wide variety of cases. Our fellows get exposed to almost everything. And I think that's a great learning opportunity for our fellows. Anything else, Dr. Abrams?
Well, I mean, the diversity, I think we probably do have University of Chicago has a pretty diverse population as well, but I think that we probably have the most culturally and socioeconomically diverse population, which has its own challenges, but that's certainly something that I think is not unique to this hospital, but probably unique among the group that we're talking about here. And I mean, I think the faculty is extremely interested in teaching. It's a relatively small program, and I think that you get a lot more personalized attention maybe than one might get in a larger program.
I should also add that our faculty are very, very involved in the teaching and guiding, mentoring people and in their careers if they're interested in either tracks, either academia or the private practice.
Perfect. Do we have any fellows out there right now? If so, if you would like to maybe share your personal experiences, that might be helpful.
Yeah, I'm the fellow at University of Illinois. My name is Carl Chiaveri. Yeah, I think that from my perspective, the breadth of pathologies that I've been exposed to is second to none. I wrote, as Dr. Manatsakanova pointed out, I rotated at Jesse Brown, VA, Shriners Hospital, Children's Hospital, MDA Clinic, and then the very diverse population that I see at UIC is just a very nice mixture of different pathologies. So we also see complex cases, but I think I'm exposed to a lot, and that's, I think, something that's a strong suit for this program for sure.
As we close up, just give you a couple ideas of things coming up. So you should have started receiving some mailings or advertisements for the spring virtual conference. So that is going to happen March 2nd through the 5th. So registration is open for that now. One thing to keep in mind for you residents, if you are part of a training partner program, you do get to register for the meeting for free. So it's a wonderful opportunity to get into the meeting. You still need to register, but your fee will be waived. All right, and then of course there's the AANEM annual meeting. We are hoping that this year that we will be in person. Of course, we're not going to know for sure until closer to it when we see what's going on with the COVID pandemic. Thank you so much for joining us. We appreciate the time that you've given us because we know how busy you guys are. So it's awesome to be able to see and hear from your own words about the programs. We hope this was enjoyable. Hopefully you've learned a lot of information and it's been valuable. We can continue to bring this event to you for years to come. It's been wonderful on our end, so hopefully you're enjoying it on your end. Good luck to both the programs and the residents. Thank you so much. Have a great night, everybody.
Thank you.